Not only have we seen a jump in the number of new infections on Wednesday, but also the highest ever number of critically ill patients.
Yes, and that's why local authorities are on alert, figuring out ways to bring this number down before it starts to overburden the health system.
Yeah, it's a big problem. So for the latest, we have our Shin Ye-eun in the studio with us. Good morning, Ye-eun.
Good morning.
Well, Yan, let's start with the number of daily infections. We're expecting today another jump on the horizon.
Yes, Mok-yeon, because we've seen yet another jump from the number of cases reported as of 9 p.m. on Wednesday. 2,140 infected. This is up 76 from the day before. So we're expecting to see the daily figure for Thursday be near the 2,500s.
Yeah, so this is a problem, of course, the number going up in general, but there's also, perhaps you could argue, an even bigger problem in terms of the number of critically ill patients. Now, yesterday we saw an all-time high. Perhaps when the numbers come out for Thursday, it will be even higher. So what are the authorities saying about this?
Right, so the number of critically ill patients hit 460 yesterday, the highest number we've ever seen. And authorities insist that South Korea's health system can handle the uptick for now. Take a listen to what the Prime Minister had to say.
Several indices are worsening faster than expected, including the number of critically ill patients, fatalities, and the reproduction rate. It's an uneasy situation. For now, our medical capacity is stable, but we cannot rule out a repeat of the critical situation we saw last year, given the rising gatherings for the year-end, along with seasonal factors.
Authorities are urging senior citizens to get shots and also boosters. That's because these groups are at the highest risk.
The fatality rate of the elderly over the age of 80 who haven't been vaccinated is as high as 14.71%. But once they do get vaccinated, this number goes down significantly to 3.46%. So we ask the elderly to please get vaccinated and to get their booster shots as well.
So speaking of booster shots, how have South Korea been administering booster shots so far?
So as of Tuesday, more than 640,000 people had received an extra jab, and this includes seniors over 60 and younger people working in the healthcare sector who were first in line to be vaccinated early this year. Janssen recipients have also been eligible to get booster shots. On Tuesday alone, nearly 100,000 more people got an extra jab, and the number of booster shots administered on Tuesday actually surpassed the number of first dose inoculations during the same 24-hour span. Authorities are still weighing the option of regular booster shots, but it's taking a wait-and-see approach for now to see what other countries do first.
So while we're on the subject of what other countries are doing, Japan is about to start administering booster shots to people over there as well, certain age groups, certain sections of the society. But how are they planning on doing it? What are the similarities and differences compared to Japan's plan and South Korea's plan?
Right, so Japan's health ministry on Wednesday first said that they gave the green light to booster shots using the Pfizer vaccine. Similar to Korea, they will first administer these extra jabs to health workers from December. A slight difference is that they might expand their target age group to every adult aged 18 and up. And once they have more data on whether administering extra jabs to younger generations is safe, Japan might bring the age bracket down even further. And detailed guidelines will be revealed on Friday.
Well, Yan, I also hear that some countries are taking much stricter measures to penalize those who break virus prevention measures. Can you tell us more on that?
Right. Take China, for example. It's taken a very aggressive approach to keep infections down. In February of 2020, Chinese state-run media reported that a court in one of China's provinces published an urgent notice that said anyone who spreads the virus intentionally and endangers public security would be subject to the death penalty if the situation is severe. Those who spread false rumors about the pandemic could also face up to 15 years in jail as well. As of now, there isn't any specific statistics showing how many Chinese citizens have been found guilty for any of these crimes. Nowhere near the death penalty, of course, but countries like the UK, Saudi Arabia, and South Korea fine people who break quarantine. If you take Saudi Arabia, for instance, it fines first-time offenders more than $53,000 US or can impose up to a 2-year jail sentence.
Yeah, Saudi Arabia has very strict punishment, but nothing compares to China, so it makes you wonder whether they're playing a little bit loose and fast with the official data they're putting out. Of course, the death penalty for potentially spreading the virus seems a touch severe, if you don't mind me saying. But thank you very much, Ye-eun, and we'll see you again tomorrow. Thank you very much.
Thank you.